It's time for the Dr. Cho Show, the show that helps you understand the latest and safest modern dental techniques for you and your family. You'll become an educated dental consumer and also learn about health trends outside of the dental industry. Here's your host, Dr. Dan Cho.
Hello everybody, welcome to the Dr. Cho Show, your number one resource for everything related to your oral health. My name is Dr. Dan, and what I wanted to talk about today is when would somebody need, sedation dentistry? Really, again, like I kind of alluded to before, it's for those who are extremely afraid or anxious about really any type of dental treatment. Typically, these people have a combination of traumatic past experiences, general anxiety, fear of medical setting, also known as white coat syndrome. And a combination of all of those can make somebody really avoid going to the dentist unless they're in an extreme amount of pain. Even then, sometimes they can really avoid going to see the dentist. And sedation dentistry, minimal or moderate typically, bringing that on board can be really effective in what may be necessary to actually reduce the amount of anxiety and stress to allow for somebody who is very fearful to be able to get the proper treatment. Because I've said this before, I'll say it again, teeth are not luxury bones. Despite what any insurance company may say, you need your teeth. You never see those posters drive down the freeway, you see those posters, and or on social media or whatnot, you see a poster and somebody's smiling and they're missing a front tooth, and you say, okay, what's going on over here? They're missing a front tooth, and most everybody will see that as the very first thing. But then if you go back and take a look, you'll find that, oh, the person's also missing an eyebrow, has a sixth finger on a single hand, has something else. But people don't immediately go to that. They don't immediately notice that. The first thing that they notice are teeth, and anything that's missing, and that could really play a huge factor in somebody's psychology as to whether or not are they going to be social. There's a lot of other things. Sorry to go off on a little bit of a tangent. Obviously, it's something that I feel very strong before. With minimal sedation, nitrous oxide is the most common used pharmacological agent, and like I mentioned before, nitrous oxide extremely safe, very effective, great anxiolytic drug, has a fast onset, fast recovery time. I mean, it works really well. The biggest downside to it is that the level of anxiolysis or stress or anxiety reduction may not be enough for most people, so sometimes you have to kind of up it to something else. So another form is something called oral conscious sedation. So if you go to your dentist and they say, oh yeah, we can do sedation here, take this pill, that is not as that can be moderate sedation, but really moderate sedation providers such as myself, the IV intravenous route is going to be much more preferable over the oral conscious. And so oral conscious is, you take a pill. Typically, it's going to be a benzodiazepine, which is prescribed for anxiety, insomnia, CNS pathology, central nervous system pathology, epilepsy, a bunch of different things. Xanax, Ativan, Valium. Those are kind of really commonly known benzodiazepines, and depending on the drug, oral conscious sedation can have various different types of effects, and that are also potentially stronger than nitrous oxide. For instance, it can be used to treat a variety of sleep problems, anxiety. Some of them actually have amnestic properties as well. Another nice thing about them is because they're taken orally, you don't need any type of line place. There's no need for cannulation to place a catheter into somebody's vein, which that also can be another source of fear and anxiety. So, but there are a handful of downsides to oral conscious sedation. So one of them, and the biggest one, is kind of the lack of control, and also consequently, with a lack of less control, it tends to be less safe if something bad were to happen. So what I mean by that is oral conscious sedation, when you ingest it, you don't have direct access to the bloodstream, meaning that reversal agents, if you were to get pushed too far, it would be more difficult to get on board. In addition to that, oral conscious, if you take a pill, it can take longer for it to take effect. IV route, which I'll talk about in just a second, can take anywhere from as little as 15-20 seconds to take effect, whereas the oral conscious route may take an hour, sometimes 90 minutes to kind of really kind of take into effect. And so it requires a little bit more time. And additionally for that because it has to go through the digestive system, something called the first pass effect comes into play, which kind of leads to sometimes an unreliable rate of absorption. What that basically means is that part of the when you take a pill and you take let's say a zero point 0.5 milligram dose of triazolam or something like that, sometimes not all of the 0.5 milligram actually makes it to the site of effect, makes it to the brain. Sometimes 0.2 or 0.3 or whatnot, but part of the drug already gets metabolized prior to reaching the site of action of the brain, and makes it less prior to reaching the site of action of the brain, and makes it overall less effective. And so that can also, there's a lot of unpredictability and variability with it. And so I've done oral conscious for quite some time. It was something that I did like, but it's like trying to drive a car without without a brake pedal. You can kind of ramp up, but in order to slow down, you can't. You kind of have to coast and wait for the car to slow down by itself. And so there's a lot less control when you're doing oral conscious, which means that it can be riskier and can be less safe. And so generally, if you're going to be taking the oral conscious route, you have to be a little bit more cautious about, or at least I should say the provider needs to be a little bit more cautious about it. So additionally, if you go down that route, it also can mean that you have to that you do have to actually have somebody drive you to and from the office as well. So my preferred route is obviously through the brain, to the brain, through a vein. And this is where you can titrate in various different types of medications. Typically, like I mentioned before, benzodiazepines, opioids are also used as an adjunct as well. And then if you were to go into deeper levels of sedation, you can also use general anesthetics as well, such as propofol, those sorts of things. But that's not really the kind of the point of this podcast. I really want to focus mostly on minimal and moderate. So, like I mentioned before, the biggest advantage is that the onset is significantly faster. Additionally, the depth of sedation can be titrated effects, meaning that the exact amount of drug that needs to be used is used. You don't get any more, you don't get any less. This gives a much higher degree of control, and also in turn a higher degree of safety. And again, at the end of the day, that's where we're always concerned about. We want to make sure that it is safe. We don't want to do anything that's going to risk the health of the patient. And so, in the event of an adverse event, appropriate drugs and reversal medications can be administered quickly, and they take effect very, very, very quickly because, again, you have access to the brain through the bloodstream. And so, some of the negatives about it is that there is a risk of it getting pushed into deep sedation, but that can be really, really mitigated if you have a provider who's very safe and very methodical about getting pushed, about not pushing the patient too far. If you go and you read stories about somebody who dies or this or that, something that happens, there can be, the operators maybe being a little too cavalier or using a medication that they shouldn't have, and so you really, really want to be making sure that the provider needs to be really, really careful about not doing too much drugs or an inappropriate drug, because that can lead to adverse events. As previously mentioned as well, there are a lot of precautions that are being taken. A lot of the vitals. There's a lot more training that needs to go on to be done to actually become a moderate provider through IV sedation. And again, I'm biased. I realize that it's fantastic, works very, 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 very well. Some of the other kind of bad things about it is that you do need to be NPO, which stands for nil per os, which basically means you can't eat for about 68 hours prior to the appointment, and typically only clear liquids up to 2 hours prior to the procedure. This is a rule that cannot. This is a rule that cannot be broken. I cannot emphasize that enough. Even if you're a little hungry and you have something 5 hours prior to, that is a hard no. There's no wiggle room behind this, and it's not because we're being cruel. It's not because we don't want you to eat, that we want you to starve or anything like that, but this is a really big safety precaution. Some of the medications and the techniques can cause somebody to actually vomit, and if they vomit while they're being sedated, one of the worst things that can happen is they can aspirate that food or liquid, meaning that it goes out of the stomach and into the lungs, and if anything were to get lodged inside the lungs, the patient could die. So it is a very, very big safety precaution, and it is something that we're very, 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 very strict on, because it's just not worth it. It's to potentially die because they want to have a little bit more. It's like, oh, it should be fine. No, it is something that you really, really want to make sure that you're very, very, very safe with. And again, that's something that I'll stress quite a bit. So another barrier is typically cost. IV sedation costs more than minimal sedation, but truth be told, IV sedation is one of the safest and most effective ways to address moderate to extreme dental fear for a vast majority of the general population. Now, there are some people that they do need general anesthesia, but those are typically pediatric patients, or those who are really unhealthy, those that have kind of major health complications that on the on an ASA scale, which is a measure of the health of an overall patient, if they wouldn't be a good candidate for moderate sedation, in which case they may need to be seen in a hospital setting under deep or typically general anesthesia. In further episodes, we'll talk about the actual dentistry. We've talked about implants a couple episodes back. We will talk about various other aspects, root canals, crowns, fillings, all those sorts of things. And so sedation itself is kind of a little bit of a point where I'm very kind of really passionate about. And so like I had said at the very beginning, if you're stuck with me over here to the end, I'll tell you how to get a free consultation for it and possibly get some free dental sedation. So that is really just, again, contact my office, get a hold of me. My office phone number is 503-646-4600. You can give us a call, and another way you can do is you can email us at info @lifebloomdental.com. That's LIFEBLOOM dental dental.com, BLOOM dental.com, or you can also go to our website, which is going to be portlandsdentist.com. That's Portland with an S, portlandsdentist.com. You can look me up and all that other good stuff. And so, and the reason why I say that possibly get it for free is that I actually don't charge. At least I don't charge for dental sedation. Is something where I have a current passion for it. Is something where I would like to be able to help as many people as possible. And for this aspect, I just enjoy it. And so, if you want to hear about any of that, if you want to have a quick chat, if you have any questions about any of that, get a hold of us, and we can figure out a time to figure out how if sedation is right for you. So really, outside of that, if you do have any
Thank you for listening to the Dr. Cho Show. If you have any questions for Dr. Cho, you can reach him at www.portlandsdentist.com or by calling his office at 503-646-4600, or feel free to send him an email at info@lifebloomdental.com.